Our topic for today are the emotional and psychological complications of the puerperium. So, inability to bond is a postpartum complication with far-reaching implications. Now, for a woman whose child is born with an illness or is physically challenged, the woman may feel angry, hurt, and disappointed with loss of self-esteem. Parents are shown their child moments after birth, so if a condition or problem exists, it can be immediately explained to them. Although this is a shock to couples, it allows them to face the problem with support people readily available. The physician or nurse midwife usually makes it her or his responsibility to tell the parents about the defect. People who are under stress are not good listeners and may need repeated explanations before they completely understand the problem. Open lines of communication between the parents and the healthcare provider allow for free discussion of feelings and fears. Now, for a woman whose newborn has died, so they may feel bewildered, perhaps bitter and resentful to the hospital staff since they cannot save her child. Most women are interested in seeing the baby. This is generally therapeutic because it helps them begin grieving. We clean the baby, wrap the baby in an infant blanket, and bring him or her to the parents. Do not place a woman whose child has died in a hospital room with a woman who has a healthy baby. Provide a private room to allow the woman the opportunity to grieve. Allow her family to visit freely. She needs them with her to fill a portion of the void left by her loss. Now, for the postpartum blues. The onset is within days after the delivery and lasts usually 2 weeks. They may have mood swings, crying, irritability, anxious worrying centered on the neonate. It may diminish within a few days, and treatment is usually reassurance, family support, and follow-up. Now, for the postpartum depression, it appears 1 to 10 days postpartum. Hormonal shifts as the levels of estrogen, progesterone, and gonadotropin-releasing hormone in her body decline to rise are the usually culprit. They may exhibit extreme fatigue, inability to stop crying, and increased anxiety about her own or her infant's health. They may feel insecurity, especially unwillingness to be left alone or inability to make decisions. Psychosomatic symptoms such as nausea and vomiting and diarrhea and either depressive or manic mood fluctuations may appear. And now for the risk factors for the postpartum depression. It includes a history of depression, a troubled childhood, low self-esteem, stress in the home or at work, and lack of effective support people. A woman may need counseling and possibly antidepressant therapy to integrate the experience of childbirth into her life. Next would be the postpartum psychosis. So as many as 1 in 500 has enough symptoms during the year after the birth of a child to be considered psychiatrically ill. Now, in postpartum psychosis, rather than being a response to the physical aspects of childbearing, it is probably a response to the crisis of childbearing. The majority of these women had symptoms of mental illness before pregnancy. If the pregnancy has not precipitated the illness, a death in the family, loss of a job or income, or some other major life crisis would probably have precipitated the same recurrence. So women with postpartum psychosis usually appears exceptionally sad. By definition, psychosis exists when a person has lost contact with reality. A woman with a postpartum psychosis may deny that she has a child, and when the child is brought to her, insist that she was never pregnant. She may voice thoughts of infanticide or that her infant is possessed. Her sensory input is too disturbed to comprehend. She may respond with anger or become equally threatening. A psychosis is a severe mental illness that requires referral to a professional psychiatric counselor and antipsychotic medication. And now for the summary. Postpartum blues onset is 1 to 10 days after birth, while your postpartum depression is 1 to 12 months after birth, while your postpartum psychosis is within the first year after birth. For the postpartum blues, symptoms usually are sadness and tears, and the incidence is 70% of all births. It may be because of your hormonal changes or stress of life changes. Therapy includes support and your empathy, and the nursing role for nurses is to offer compassion and understanding. Now, for your postpartum depression, it may have symptoms of anxiety, feeling of loss, and sadness. Incidence 10% of all births. Etiology, they have history of previous depression, hormonal response, and lack of social support. Therapy includes counseling and drug therapy. For your postpartum psychosis, the symptoms include delusions or hallucinations of harming the infant or self. The incidence is 1 to 2% of all births. Etiology is possible activation of previous mental illness, hormonal changes, family history of bipolar disorder. Therapy includes psychotherapy and drug therapy, and we refer these patients to psychiatric care, safeguarding the mother from injury to self or to the newborn. And that's it. Thank you for listening.